Hello and welcome. I am so glad you could join us today for a briefing on this new report about the human health benefits of improving forest health in California. I'm Amber Mace. I'm the CEO here at the California Council on Science and Technology, and I am delighted that we will begin this conversation today by me turning it over to Phil from Blue Forest to welcome you all with a land acknowledgement. Phil?
Thanks, Amber. Blue Forest is a remote organization with roots in what we now call Sacramento County on the traditional, ancestral, and contemporary homelands of the Miwok and Nisenan people, and the gathering places of the Patwin, Wintun, and Maidu people. These homelands include the Sacramento, American, Cosumnes rivers, sacred sites, and cultural landscapes that make up their rich heritage. We here at Blue Forest are an organization that is a nonprofit focused on financial innovation for sustainable environmental solutions. We have a particular area of focus on forest restoration in the Western US to address the catastrophic wildfire challenge we're all experiencing. I will now turn it back to Amber to introduce CCST and our briefing today.
Thank you so much for that land acknowledgement and for saying a little bit about Blue Forest. We are so delighted to partner with you and your team at Blue Forest on this report. I'm going to tell all of you a little bit about CCST as an organization, and then I'm going to walk you through some of the background about how we do a study like this, talk about our steering committee and our study team just a little bit, and then turn it over to the study teams and the chair of the steering committee so you can hear about the results of this report. And there's so much in here. So that's one of the things that we're going to ask you to do is listen today, but also go to our website and look for the full report there, and you can get all the details, including all of the findings, conclusions, and recommendations. So first of all, we at CCST are a nonpartisan nonprofit. We were created at the request of the California legislature to be a resource to California policymakers here in Sacramento, which is where we're based. And we have been able to deliver science and technology advice to policymakers in the executive branch, the legislature, and the governor's office through reports, peer-reviewed reports like this, other briefings that we organize, all sorts of different services that we provide based on policymaker needs. And one that you may be familiar with is our fellowship program, where we place PhD scientists and engineers for a year of government service and leadership training. So we are delighted to serve in this role and take on complex questions like that were posed in this particular topic. Next slide, please. So a little bit about this scope of this study. This has been developed based on interviews with California health sector organizations and a literature review to explore the connections between forest health management, wildfire smoke, and human health. We all know that those are connected, but this was a very deliberate approach to make the connection and think about creative ways to bring uncommon bedfellows together to solve these complex issues of these catastrophic wildfires that we are facing in California. So we are grateful to the funders who were able to make this possible. This included a grant from the Innovative Finance for National Forests Grant Program, which is co-managed by the U.S. Forest Service, as well as the U.S. Endowment for Forestry and Communities. We also benefit from funding from CCST's Disaster Resilience Initiative from the state of California, as well as the J.M. Kaplan Fund and the Alumbra Innovations Foundation. Next slide, please. So a little bit about our study process. To carry out a peer-reviewed study like this, we use a very rigorous process, and it involves putting together a balanced team of experts that are participating throughout the entirety of the study. And I'm going to say a little bit more about those study experts in just a minute. We also undergo a conflict of interest evaluation and an external peer review process to ensure that all of the findings, conclusions, and recommendations are credible, relevant, and useful to state decision makers, as well as everyone that we hope will have access to this report. Next slide, please. And here are the amazing people who contributed their time and expertise to this study. We are so grateful to everyone who worked together over the last couple of years to contribute in a really meaningful way all of the experience and expertise that they have to make this report both useful and actionable. So these are the members of our steering committee that are pictured here. You're going to hear from Jennifer in just a minute. We also have listed our study team members, both from CCST and this wonderful collaboration with Blue Forest. And next slide, please. So this report is organized in two parts. I want to call attention to that. The first part is based on interviews, and the second part is a literature review. And our presentation today is intended to give you, again, a very brief overview of the key takeaways, the main takeaways. And I'll re-encourage you to go to the website, download the full report, and look at all the findings, conclusions, and recommendations in detail. Now I am so happy to invite Jennifer Montgomery, who's the chair of the steering committee, to join us and begin telling us about the big findings from this study. Thank you so much for your service, Jennifer, and everything you did to make this possible. Take it away.
Thank you so much, Amber. It was an absolute delight. On behalf of the steering committee, thank you all for joining us today. In this report, we will highlight multiple pathways toward a better understanding of how forest health management can be used to promote and support positive public health outcomes. Next slide, please. Our first key takeaway from our interviews is that the adverse human health costs of wildfire smoke, including operational and personnel impacts on the health sector itself, remain largely unquantified. In order to more fully engage in forest management planning, the health sector needs to better understand how to calculate their costs of wildfire smoke, and they require more information on how to plan for and respond to wildfire smoke events. Next slide, please. Our key takeaway from chapter 2 is that many health sector organizations do see value in future engagement with forest management as part of a shared management effort, as a comprehensive approach to both forest resilience and to human health benefits. Many interviewees highlighted two specific issues they would need to have addressed in order for this enhanced engagement. One, identifying improved avenues for better collaboration. We often heard, who do we even talk to? And two, more and better information about the human health benefits and the costs I'm sorry, I've lost track of my slide here. The human health benefits and net costs of wildfire smoke to healthcare systems from additional forest and wildfire smoke mitigation efforts, as compared with the current business as usual model of little to no proactive forest management. Next slide, please. In the next chapter, we switched from qualitative interviews to a review of the existing literature. Here we found that there is a need for more comprehensive statewide and locally specific information that is available to our health sector partners and others on the adverse human health impacts of wildfire smoke. Analyzing existing and future research will help better to identify the negative impacts and show us how we can mitigate for future smoke impacts. Next slide, please. Finally, our last chapter shows that although there is a small but growing body of work that suggests that alternative forest management practices such as thinning, mastication, and managed fire can be targeted to reduce net wildfire smoke and negative human health impacts, we do still need more data. It is only recently that researchers have begun to quantify that better forest and smoke management can indeed offer greater opportunities for both cleaner air and improved human health. An added bonus is that this will create more chances for robust partnerships with the healthcare sector, historically underrepresented, and smoke-impacted communities. Next slide, please. Out of these takeaways, we bring forward 3 recommendations that offer a clear and directed path toward reduced adverse human health impacts, lower costs to healthcare systems, and more resilient forest ecosystems. These recommendations are that that California and the federal government should, 1, prioritize interested health sector organizations' participation in existing and future forest management advisory bodies to better strengthen planning for and implementation of forest management practices with an eye specifically toward human health outcomes. 2, expand upon existing smoke data products to create inventories tracking wildfire smoke, PM 2.5 concentrations, population exposures, and the adverse outcomes from those smoke exposures. 3rd, we recommend additional research studying the human health trade-offs of differing forest and smoke management practices. To recap, better cross-sectional linkages, creation of smoke impact inventories, and additional research on and implementation of multiple approaches to forest management will be the keys to our success. We will now move on to Chapter 1 of the report. Thank you.
Thank you, Jennifer, for that great introduction. And now I will start with a little bit of background on how we came up with this kind of our motivation, I should say, for doing this report. Next slide. So as we have all experienced and are familiar with now, California's forests are burning at increasing size and severity. And these catastrophic wildfire events are creating intense, widespread smoke plumes that are impacting communities both at the fire's edge, but sometimes even thousands of miles away. Next slide. And these smoke events have been leading to adverse health outcomes, including respiratory and cardiovascular impacts, but many others. And these are especially being felt by vulnerable populations. So researchers are now estimating that these health impacts from wildfire smoke may be the largest economic impact from wildfires, with some researchers estimating impacts in the $100 billion and citing that this is likely a conservative estimate. So what can be done? Next slide. One reason, and there are many reasons that we are experiencing these catastrophic wildfire events, is because our forests are really degraded due to legacy fire suppression policies, climate change, and then the creation of forests which are now in an overstocked and degraded condition. And in the mixed conifer dry forests of California and the Sierra Nevada, forest management is actually a proven approach to increasing the resilience of our forests. So on the left, we see a photo of an overstocked, degraded forest. And then with forest management, we can move our forests into a more healthy state like we see on the right. And so throughout the report and presentation, we're going to be referring to the term forest management a lot. And in this, we're talking about the combination of forest restoration, which are treatments like mechanical thinning and prescribed burning designed to restore the forest to its more natural state, plus fuels reduction, which includes removing small diameter trees and surface fuels to reduce the risk of severe wildfire. And with these treatments, we can create more resilient forests so that when there is a fire, the fire will be a low-lying beneficial fire instead of a catastrophic one. Next slide. However, beneficial fire, which is a critical part of forest management and includes prescribed burning and cultural burning, also emits smoke. So this photo is actually a smoke plume from a prescribed fire. And as you can see, it's pretty significant. So therefore, there will be smoke trade-offs that occur when we look at smoke from catastrophic wildfires and untreated forests, from prescribed fires, and then also from smoke emitted from fires in treated forests. And then these smoke trade-offs will also have different health outcomes. Next slide. And these trade-offs really set the stage for our research and our theory of change. So we can think about a degraded forest where we have increased smoke emissions, a large population exposed during repeated severe wildfire smoke events, which then leads to adverse health outcomes and also are then translated into financial costs as estimated in the hundreds of billions by researchers. Next slide. However, in a healthy forest, we can think about the potential for reduced smoke emissions and exposure, reduced adverse health outcomes, and then potentially reduced financial costs. Next slide. And so if this theory of change is true, and since a smoke-free future does not exist for California, opportunities for cross-sector collaboration to meet shared goals may exist if accelerated and proactive forest management can help us meet ecological, human health, and economic goals for both the health sector and forest management sector. So put another way, if forest management can lead to net improvement in health outcomes from decreased wildfire smoke, and therefore there may be an opportunity for the health sector to engage in forest management. And we really want to be clear that the goal of working together between forest management sector and health sector is not for interested relevant parties that are not in forestry sectors to make technical decisions about forest management, but it's really for these parties to help support, promote, and provide perspectives that can lead to improved outcomes for all. So when we're talking about engagement, we're really talking about community engagement, advocacy, cost sharing, or other ideas for the groups to work together. Next slide. And so given these connections between forest and human health, there may be an opportunity, again, for health sector and forest management sector to work together, but many questions remain. And so these are the questions that we tried to answer in this report. First, we wanted to know, how is wildfire smoke actually impacting the health sector? What is their perspective? And how do they perceive potential opportunities to engage in forest management? And then second, is there actual evidence that improving forest resilience actually delivers human health benefits related to wildfire smoke and trade-offs from different scenarios? So with that, I will pass it to Signe to talk about findings from part 1 of the report.
Thanks so much, Kim. I'm Signe Stroming, and I'm excited to dive into some results. Next slide, please. So as Kim noted, past research suggests that the economic impacts of wildfire smoke on health are in the billions of dollars and could be the biggest economic impact of wildfires. We wanted to understand if and how the health sector in California is experiencing these impacts, and if they are quantifying any of the financial costs. Those are the results we present in Chapter 2. If the health sector is experiencing these impacts, that could be a strong foundation for potential collaboration. So we wanted to explore the health sector's interest in engaging with land managers around forest management. That's what we present in Chapter 3. Next slide, please. Because this is such a novel and exploratory topic, we decided to do qualitative interviews with public health, health systems, and health insurance organizations in California. These are all groups that the literature suggests might be most impacted by wildfire smoke. For public health, that included local, state, and tribal governments, as well as non-governmental organizations. For health systems, that included hospitals, clinics, and healthcare delivery organizations. And for health insurers, that included those serving Medicare and Medi-Cal groups. We outreached to almost 350 individuals representing over 200 organizations. We ended up interviewing about 60 individuals. These were hour-long, semi-structured interviews conducted via Zoom, all in 2022. And the charts on the right side of this slide show the spread of interviewees across that sector group and the geographic service area of their organization. For analysis, all interviews were transcribed, and we iteratively coded that qualitative data. The patterns and themes identified through that coding of qual data were used to develop the findings in this report and this presentation. Next slide, please. So let's dig into Chapter 2. And as a recap, the key takeaway for this chapter is that wildfire smoke impacts human health and health sector organizations, workforces, operations, and ability to provide services. yet the costs are largely unquantified. Next slide. So we found that wildfire smoke has real and growing impacts on health in California. The impacts described by our interviewees fell into two main categories: impacts to human health and impacts to health sector organizations. Next slide. On impacts to human health, interviewees shared with us what we largely also know to be true from the literature. Wildfire smoke has direct and acute impacts on human health, especially on respiratory and cardiovascular health. Our interviewees also expressed concern and wanted more information on other types of impacts. They asked what the chronic and cumulative impacts of smoke exposure are. They wanted to know about the mental health impacts of smoke exposure, and in many cases expressed concern about smoke exposure for specific vulnerable populations. Next slide. Beyond impacting human health, we found that wildfire smoke is also impacting health sector organizations. Next slide. It's impacting their workforces, their operations, and their ability to provide services to patients. We heard that workforce impacts were cross-cutting, really across all of the sector groups we heard. That included unsafe working conditions, challenges in getting to work during smoke events, or in some cases, even recruitment and retention challenges around wildfire smoke. Other actions and impacts from smoke really varied by sector and varied based on kind of the traditional responsibility of these groups. For public health, that typically focused on communication and coordination with other entities. Health systems were focused on improving air quality in their facilities and ensuring their patients got care. And health insurance was broadly focused on continuity of care. One point to really emphasize here: wildfire smoke impacts to health organizations are not equally distributed. We found that in particular, public health departments and health systems serving fire-prone, rural, resource-constrained, or otherwise vulnerable communities described more intense impacts. This is a really brief overview. We really encourage you to check out our whole report where we get into a lot more detail and color of what we heard from our interviewees. Next slide. So we know that wildfire smoke has human health impacts as well as impacts to health-focused organizations. Next slide. And those impacts result in financial costs. Next slide. Yet what we found is these impacts are rarely quantified or calculated. This was pretty surprising for us. You know, we heard that researchers are estimating these costs in the billions of dollars, yet the health sector itself is broadly not calculating or tracking these costs. What that means is we still don't know the real costs or fully quantified impacts. Most of the people we spoke with said that their organizations would be very interested in understanding this number, understanding the dollar value of these impacts. And a few groups, especially health insurers, mentioned that they might already have the data in hand to be able to do so. But in reality, most groups are not tracking this. And this could be for a couple of reasons. One, this is just a newer and emerging problem, and tracking these kinds of costs takes time, people, and expertise. And again, really the most smoke impacted organizations and communities are the ones with the least amount of time to be able to track these events. They're busy dealing with the smoke itself and other health challenges, and taking care of their staff, communities, and facilities really takes precedent for them. The quote on the right side of the slide is a good example of that. And with that, I will pass to Kirsten to share results from chapter 3.
Great, thanks, Signe. Now I'm excited to take us through the results of chapter 3 of our report. And the key takeaway from this chapter is that many interviewed health sector organizations see value in future engagement with forest management to meet shared goals, but they require avenues for collaboration and more information on the potential health benefits of that engagement. Next slide, please. So given the impacts of wildfire smoke on human health and the health sector that we heard about from our interviewees, we explored possible connections between the health sector and forest managers. And this exploration was really based on the premise that if accelerated forest management can deliver both human health and financial benefits, there may be an opportunity for some in the health sector to collaboratively engage with land managers to further advance forest management to the mutual benefit of both parties. Next slide, please. And about half of our interviewees explicitly connected forest management and forest health to human health, but most indicated that they aren't conceptualizing forest management as a tool that is relevant to their work in improving or supporting human health. And the quote on this slide is one good example of this. Prescribed burning also commonly came up in our interviews, and interviewees recognized it as an important forest management tool, although some did raise concerns about smoke exposure for nearby communities from prescribed burns. Next slide. So next, we explored their willingness to engage with forest management. And as Kim mentioned earlier, this collaborative engagement could take several forms, including but not limited to community outreach, advocacy, funding partnerships, multidisciplinary research, and considering health trade-offs in forest management planning and implementation. We found that many interviewees think that there should be greater engagement between the health and forest management sectors for wildfire smoke reduction, but often they either did not think their organizations were the right ones to participate, or they expressed that they were unsure how to go about participating even if they wanted to. And this shows that there really is an opportunity and interest from many in the health sector in being engaged with forest and land management, and our interviewees further identified concrete barriers that could be addressed, as well as motivations to begin to foster this engagement. Next slide, please. So we asked which motivations and barriers were particularly salient for interviewees, organizations, and the health sector. And the most commonly mentioned motivator was demonstrated human health benefits of forest management, followed by a sense of climate urgency and by a demonstrated financial return for health sector organizations that engage with forest management. On the flip side, the number one barrier to engagement that we heard was financial constraints among health sector organizations, followed by capacity constraints. And also common was a recognition from our interviewees that they have heard of controversies regarding forest management or of varying opinions among their communities, and that therefore health sector involvement could be tricky. As we heard about these motivations and barriers, interviewees also highlighted key information needs that could support or help to unlock health sector participation in forest management. Next slide. And information gaps that were identified included information about the impacts of smoke on human health and on the health sector through, for instance, impacts on resources and capacity, as well as information about the health benefits of accelerated forest management and about the impact that health sector engagement could have on those health benefits. Also, across these information gaps, we frequently heard that information should be made available at locally applicable spatial scales and in forms that are accessible to diverse audiences. Our interviewees also highlighted that institutional structures or models of collaboration are necessary, as called out in the quote on this slide. As I said before, many of our interviewees didn't know how they would begin to collaborate with land managers, even when they wanted to, because those structures don't currently exist and the path forward is unclear. Next slide. And with that, I will pass this over to Teresa to talk about part 2 of our study.
Okay, thank you so much. Hi, everyone. I'm Teresa with CCST and happy to present the second half of our report, which was a literature review. And for this half, we conducted a review of the academic literature, technical reports, and publicly available data resources to address 2 of these knowledge gaps that we heard from our health sector. In chapter 4, we explore do we have the data resources that we need in order to better understand what the health impacts from wildfire smoke are. And in chapter 5, we look at, do we have any evidence that forest management to improve forest health and reduce wildfire risk can actually also provide a human health benefit by reducing health impacts from smoke. So starting with chapter 4, looking at the data resources, our key takeaway here is that comprehensive statewide or locally specific information on adverse human health impacts from wildfire smoke are not readily available. You can't just go look them up particularly easily, but they can be generated from additional analysis of the smoke data resources that we do have. So as it's been mentioned elsewhere in this talk today, it's very well established that wildfire smoke can cause whole sorts of different types of adverse health outcomes, including respiratory effects, cardiovascular effects, and even death. And in order to estimate these types of indirect health impacts, researchers typically rely on 3 types of data products. These include information about smoke emissions, which are metrics that tell you what is in the smoke and how much of the different air pollutants is being produced by the fire. Smoke dispersion metrics, which tell you where the smoke plume travels across the landscape, and then the concentration of the air pollutants within those smoke plumes. Smoke population exposure to smoke metrics, which tells you the size of the population and their specific vulnerability to smoke exposure. And these 3 types of data are used by researchers to estimate what those adverse health impacts are from the smoke exposure. So for our literature review, we went through and sort of characterized what kind of publicly available data products are readily available for these different types of important smoke metrics. Just go through some of the big highlights here. For smoke emissions, US EPA National Emissions Inventory is tracking the emissions of a bunch of different air pollutants, including PM2.5, which is important for the health estimates. And they're doing this for individual wildland fires, both wild and prescribed fires across the country. And this inventory is updated every 3 years. It's a very useful inventory. It does have one sort of known limitation that folks are working to address, and that's the emissions estimates are made for only the vegetation that is burned by the fires. And so for fires that burn into the WUI and burn human-made materials or houses, the emissions from those types of fuels are not currently included within the estimates. It's something that researchers are working on, but it means right now it's hard to understand kind of the relative smoke risk of different types of fires. For smoke dispersion, NOAA publishes the fire and smoke product daily to show where smoke plumes are across the country. And there's a nice Air Now fire and smoke dashboard where you can go look up what the current conditions are. Once we know where the smoke plumes are, researchers need to know what the concentration of PM2.5 within that smoke plume is in order to make the estimates of the health impacts. We currently don't have any inventories that are regularly tracking smoke PM2.5 concentrations, but there have been a couple of studies that actually came out after we started our study, where researchers have published data sets of smoke PM2.5 concentrations for 2006 through 2020, either for the entire US or California, depending on the study. These data sets are being posted online, and so folks can download them and then use them to run their own health impact estimates. Once you know sort of how much smoke there is and what the PM2.5 concentration, you need to know the size of the population that's been exposed. This is typically measured in person days of exposure is a common metric. And again, population exposure to smoke is not being regularly tracked in an inventory, but the Vargo 2020 data set provides this information for 2010 through 2019. And then finally, what data products do we have on health impacts? So currently we don't have any inventories or data sets tracking health impacts in sort of a systematic way across California or the US. What we do have is a growing number of case studies where researchers have made these estimates for specific wildfires or regions or years. And in table 6 of our report, we've got a list of these types of health impact case studies that have been done for California. So here's the summary of what we found in terms of smoke data products. Basically, the key takeaway here is that we're tracking the smoke, but we're not tracking the health impacts from that smoke. And we've made some recommendations in the report about specific data metrics, smoke metrics in particular, that having inventories that are sort of systematically tracking this would go a long way to improving our understanding of what the health impacts of smoke are, sort of across the state, and for, the the healthcare sector can look that up for their particular community. Okay, moving on to chapter 5, where we looked at the evidence of a smoke benefit from research, from management. And here we found that there is a small but growing body of research that suggests that management to improve forest health can be tailored to also reduce total smoke impacts and benefit human health. So as Kim mentioned in the introduction, forest management in forests, particularly the dry conifer forest in California, has been a proven method to both improve the ecological health of the forest, as well as to affect the way that wildfires burn, so that they burn sort of in a more beneficial, less destructive way. And now the question is, well, what does that mean for the smoke that are being produced by these forests? So we did a review of papers that look at these smoke trade-offs, and they all sort of had the same kind of experimental setup. So they considered a forest, and they considered 2 alternative scenarios. First, the forest in a situation where it's not receiving any proactive management or treatment. So no prescribed fire, no mechanical thinning, or any other types of treatment. And the researchers then estimate how much smoke that forest is expected to produce as it burns 1 or more times from wildfire. And then they compare that to an alternative scenario in which that forest is being managed proactively and has some regular cadence of beneficial fire, prescribed fire, mechanical thinning, some combination thereof. And under that scenario, they estimate how much smoke they expect the wildfires to be producing in that healthy forest, and then also how much smoke they expect to come from the treatments themselves. So what are the smoke impacts from the actual prescribed fires as well? They add that all up, and then they compare under which scenario is producing less smoke overall. And so here are the papers that we found that are kind of running this type of smoke trade-off analysis. And they're divided up by sort of details on specifically what they were comparing. And we can see overall that there's sort of a small but a growing body of research here that is finding that under the right conditions and context, forest management, even if that forest management includes prescribed fire, can provide a sort of a net total smoke benefit. But we've also got some papers such as the Hyde and Strand paper where they found a net neutral. The untreated forest was going to produce just as much smoke as the treated forest. But in a situation where the treated forest, the smoke would come in many more smaller amounts instead of like all at once from the catastrophic wildfire. And in the Long et al. Study from 2022, just published recently in December, they looked at multiple different types of management strategies and found the scenarios they looked like had different combinations of prescribed fire and mechanical thinning. And they found that depending on what the relative actual prescription was of that scenario, you could either see a benefit or a net cost for smoke. So overall, we have evidence that forest management, even forest management that is producing smoke, can have a benefit, but it's really going to probably depend on the specifics of the local forest in question and the context and the conditions of the actual treatments that are being applied. A couple of other points that I'd like to make out here is that just to appreciate that this is a really new area of research. All of the papers that I've highlighted here in yellow are papers that were published after we started working on this study, which is more than half of them.
So we just wanted to emphasize, as Teresa was saying, a lot of the evidence on the net benefits of forest management in relation to smoke are really new. And so we're excited for future research in this very, very active area. And we suspect that there will be even more papers coming out in the future considering smoke trade-offs. One of our key recommendations is that state and federal governments should continue to support this research. We're seeing more and more evidence that there is really a health element to different forest management scenarios, but we need more evidence about what those trade-offs actually will be. So I'd like to summarize our key takeaways from our whole report. First, in our qualitative interviews, we found that wildfire smoke impacts human health and health sector organizations' workforces, abilities to provide services and operations, but these costs are largely unquantified, presenting an area of research that we really need. Second, many health sector organizations do see value in future engagement with forest management as a way to help meet their goals around services to their populations, improved health outcomes, and in general, thinking about how these collaborations can benefit both them, but the forest sector. However, there are new avenues of collaboration that are required, and we need more information on smoke trade-offs from forest management scenarios and associated with health outcomes. Third, in our literature review in chapter 4, we found that comprehensive statewide or locally specific information on the adverse human health impacts of wildfire smoke are not readily available, but they could be generated from additional analysis of existing data resources. And then finally, a small but growing and very, very recent body of research suggests that management to improve forest health and forest resilience can actually be tailored to reduce total smoke impacts and human health impacts. Our 3 summary key takeaways are: first, California and the federal government should further prioritize interested health sector organization participation in forest management advisory bodies so that we can actually strengthen the linkages between public health and the health sector and forest management planning and practice. Our second key recommendation is that California and the federal government should actually expand upon existing smoke data products to create inventories tracking wildfire smoke PM 2.5 concentrations, the populations that are then exposed to that smoke, and then the adverse health outcomes from that smoke exposure. And then third, the state and federal government should support additional research to study the smoke-related human health trade-offs of different forest management strategies in order to find ways that we can improve both forest resilience and human health. And as been said many times before, I really encourage you to check out our report. There are some links in the chat where you can learn more. And now I will pass it over to Amber for Q&A.
Thank you so much, Kim, and thank you for jumping in there. That this is teamwork at its best. And for just as a reminder, you will have access to all these slides on our website, and there's going to be a recording of this video, but the slides will be available too. So everything that Kim shared, you'll be able to see. So please go ahead and type in questions if you have them. We want to hear from you, and we appreciate those of you who typed in questions in your form as you registered for this event. And I have a general question to get us started, and I'd like to have Phil take the first cut at this. Phil, can you talk about what prompted this study? And then I would like Teresa, when she can join us, to add any additional context from CCST's history on wildfires.
Sure thing. Thanks, Amber. I would say the original thing that really caught Blue Forest's attention with this study was a report that CCST came out back in 2020, I think it was, that was really focused on all the economic costs of wildfires in the state of California. And if you go back and look at that report, there's a lot of great takeaways, but one that we keyed in on was really that there wasn't really the information available to even start to understand how economics, the impacts of public health from wildfires could be expressed economically. And so, given our work at Blue Forest, really thinking about what are all the outcomes and impacts of forest management and wildfires across the West, that was something that we were really interested in digging in on. And we really had the opportunity to do that in this report with CCST and really get at the knowledge gaps that still exist. Although, as Teresa started to mention, we're seeing an incredible amount of new research and reporting in this area where we're starting to get a handle on that information, but there's still some significant gaps that exist. So it was great to dig into this question specifically a little bit more in this report. Teresa,
Bill, a
anything else to
follow-up.
add there if you're on?
Yeah,
Yeah,
I'll
go ahead.
ask Teresa to add in just a minute. I want to have you elaborate a little bit more. Why this particular question? Why did you think about this interesting connection between human health and forest health and bringing sectors together that haven't previously been engaged? There's so many open questions in this space, but why this one in particular?
I mean, if you were in the state of California or anywhere on the West in 2020, I think this issue was affecting just about everyone in the West, and we're seeing this year it really, brought into affect everyone across the United States. The fires in Canada are really starting to expose smoke nationally to folks, and so acknowledging that this was maybe one of the broadest impacts across both, where forests and fires are happening in some of our rural forests, to the kind of urban metropolitan areas that are experiencing the significant and persistent impacts of smoke within their daily lives. And as smoke is coming into Sacramento today from the Northern California wildfires, it is ever present on our mind. And so really figuring that out and then tying that to something that can help maybe move the needle in this sector to add more financial support and partnership to address forest management and wildfire risk is really broadly what we thought the opportunity was on this issue.
Great. Thank you so much, Phil. And Teresa, do you have anything you'd like to share elaborating on CCST's work in this space? Particularly, you have been so involved in this and a lead for us over the years on wildfire. I welcome your comments.
Yeah, I'll just sort of echo a lot of the points that Phil made. Following our report on coastal wildfires in 2020, health impacts came out to be one of the largest sort of unquantified costs. And that's important just because it's, probably the biggest number out there. But I think I just want to reiterate this point that Phil made about the fact that the costs are happening so far from the fire in many cases, right? And that the sort of this idea that the footprint of the actual flames of the fire is not capturing the footprints of these health risks because that smoke can travel, to the next town, to 100 miles away, across the country, right, into other countries. And so this idea that the what we commonly see as sort of the footprint of the wildfire is not capturing the footprint of the health risks right now. And we just don't quite have the data that we need right now to really understand this, that there are many health organizations out there where their populations don't have a direct risk of wildfire themselves, but are being heavily impacted by the smoke. And to sort of really wrap our heads around that and really understand the health risks of the smoke. And then that also means that communities that are nowhere near a forest could stand to benefit from forest management, even if that forest isn't in their backyard because of how the smoke is traveling distances. I think the other thing that's just been interested about this problem is this question about the smoke trade-offs and what management can provide. It's a hard and it's a very technical question because the forest management itself is producing smoke, right? So prescribed fires, beneficial fires are producing smoke. They will have some amount of impact to health, and that it's really getting into this, taking a broader look of not what any individual fire is doing in terms of health, but starting to think about what the landscape is doing. So how much smoke is this forest expected to produce over the next 10, 15, 20, 50 years as we change management strategies? And how is that going to compare if we implement a beneficial fire regime versus if we continue to manage it with suppression only? And so taking this broader, more holistic view of the forests and their smoke potential as opposed to individual wildfires, I think has been an interesting takeaway from this work.
Excellent. And we've all been hearing, you mentioned, all the team members mentioned forest health and human health. I think we all have an understanding of human health, but for those of us who are joining us, don't understand how the details on what forest health actually means. Teresa, can you just say a little bit about how you define that?
Yeah, so for forest health, it's this understanding that the forests and many of the other ecosystems in California are fire dependent. They have evolved with fire, and these sort of naturally reoccurring cadence of disruptions from the fire. And for the last 150 years, these sort of natural occurrences have been very much removed from the landscape. And that's had all of these downstream effects on sort of the size and the structure and the density of trees and the vegetation. And it's had profound impacts on both how wildfires are now burning when they do occur through these forests, as well as even more complicated impacts on water quality, water quantity, biodiversity, soils, whether or not there's invasive species in there. And so sort of improving the health of the forest can change how the wildfires burn. It can have all of these other co-benefits as well that will benefit both the forest itself as well as the people that live near and rely on them.
Great. I want to build off of this and turn to you, Kim, to have you weigh in on a comment that we received from Nick from the Intertribal Agricultural Council. And he points out, and Teresa, you just mentioned that there's been some fire suppression for the last 150 plus years in California. Though prior to that, the ecosystem wasn't unmanaged. It was actively managed by the people who lived here. And Kim, can you talk a little bit about the role of traditional ecological knowledge and how that informs what you've been thinking about in terms of managing forests and what we do going forward?
Yeah, absolutely. Great question. Thank you, Amber. And I'll also leave space maybe for Jennifer to say anything. I know she has some on the ground experience working with Indigenous communities. Just want to say yes, absolutely yes. When we're talking about, restoring a forest, we're talking about maybe more of a pre-European settlement, getting our forests back into a state when Indigenous communities were intentionally managing them with fire, with smoke. Actually, there's evidence that smoke produced by cultural burning has benefits, for example, cooling rivers. And so we really acknowledge and respect and want to think about ways that we can get back to that Indigenous management and not just our, Western fire suppression or other kind of policies and initiatives. Do you want to add anything, Jennifer? I know you have some on the ground experience.
Yeah, I actually was incredibly fortunate to be able to participate in a cultural burn that was really focusing on regenerating plant products that the local tribal people used to create baskets, to create arts within their own communities. And it became really clear to me that there is a huge role to be played for this kind of fire with that eye to the cultural basis for it, right? Not just prescribed fire for the sake of prescribed fire, but prescribed fire for the sake of cultural benefits, ecological benefits, human health benefits. And we have so much to learn from our partners. And, again, as I say, I was really fortunate to be able to participate with a tribal group on the west side of the Sierra Nevada. And it became really clear to me that our not just slightly 100+ years of fire suppression that came about through federal planning, but the much longer fire suppression that came about through the Spanish settlement in California and the way that we really dispossessed the native peoples and took away indigenous practices that benefited everybody and benefited the landscape. We have so much to learn, and I'm really pleased that this question came up because it's kind of my hobby horse. So thank you.
Excellent. Yeah, we're almost out of time. And so I have one final question from the audience, and then I'm going to ask each of our panelists to think about one of the most interesting things you learned from the report, the final thing you want our audience to take away. And the last question from the audience is from Professor Carl Longley. So glad you could join us, Carl. Great to hear from you from Fresno State. And Carl asks us about the connection and what work is being done related to water quality. And Teresa, I'd love for you to start out talking about the panel that we just had at the California Adaptation Forum. And then Kim, if you have anything else that you would like to add.
Yeah, sure. So I think water quality is this other big potential benefit from improving forest health, in addition to kind of changing the smoke that's coming off of these landscapes. California's, forested areas are responsible for most of the water supply in the state. And improving forest health could also stand to have these great trade-offs in improving both water quality and water quantity throughout the state. And I'll turn it to Kim.
Absolutely. And I'll maybe even bring it back a little bit. One of the reasons that Blue Forest is so excited about this endeavor is that we really think about all of the benefits of a resilient forest, and water is central to that. And we think about both water quality in terms of, reduced sedimentation, all of the post-fire impacts, but also water quantity. If the forest is overstocked, it's using a lot of the water that could actually be in stream. And so at Blue Forest, we're working on multiple different kind of benefit models with partners like water utilities, hydroelectric utilities. And so with these models, we're able to, and hoping to be able to increasingly as models get better and better, really show the benefit to be able to connect the water sector and the forest management sector to accelerate forest management for the benefit of both groups. And so that's kind of a model that we see. Maybe this is really of laying the groundwork here in this report. But we hope that this is kind of a model that we can use for the health sector moving forward.
All right, excellent. So now quick roundup from each of you of something that you want to share, make sure the audience knows something that you learned or thought was most interesting, or a key takeaway that you want to make sure that everybody walks away with. And I'm going to go in the order of presentations, though I'm going to give Jennifer the final word as the chair of the steering committee. So Kim, you want to lead us off?
Sure. I'll say one of the most interesting things was that the health sector is interested in engaging in forest management, but we need to provide the opportunities for them to do so, and we need to have the evidence that it's worth them getting involved. But the fact that they're interested, I think, is really exciting for us to move forward from there.
Signe?
Thanks. One thing that we actually couldn't even cover in this hour was the ways in which wildfire smoke interacts with COVID and broader public health responses, and with other environmental events like extreme heat, and really how they complicate responses to the other events was something highlighted by our interviewees that was really important and interesting for managers.
Yeah, those converging and cascading disasters. And Kirsten?
Yeah, I'm going to throw in that the level of familiarity from our interviewees with fire and fire effects for one thing, but also with forest management and the ways that human health is connected to environmental health was really, really interesting and engaging to discuss with them through our interviews.
Great, thank you. Teresa?
I might have covered this when I got cut off, but I think something that was interesting that I found is that we talked a lot about forested ecosystems here. Non-forested ecosystems in California are also fire dependent. Our chaparral, our grasslands, they are a source of probably about half the smoke that's being produced in the state. And the potential for management to provide both ecological health to these non-forested ecosystems and also provide a smoke benefit is currently unknown. We didn't find any research on these sort of non-forested ecosystems. And so that would be sort of the next frontier for the research to look at.
Bill?
Yeah, I think the real takeaway for me for the report is the wildfire challenge is a human health challenge. And so when you're seeing numbers in the billions, however many billions of impact from wildfire to our public health and private health systems and the health sector broadly, that's something that really makes me think about, what is the value of doing this kind of forest management work to reduce the smoke impacts to our population broadly. So that at the end of the day was the real takeaway from the report.
Thank you. And bringing us home, Jennifer.
Thank you. I lived for 33 years on Donner Summit, and we had pretty much every summer of significant smoke impacts. And the thing that really was touched on lightly in the report, but I think will involve a much deeper dive, is the mental health impacts of people who live in persistent smoke environments. I very clearly saw it in myself. I saw it in my neighbors and the people who lived around me. And these are not just the impacts to an individual's mental health, but it's, well, I don't really want to go to work today. So there's an economic loss to us, a larger economic loss to us as well. And so although that is not, kind of a huge takeaway from the report, I think it's something that will really merit a much deeper dive. And I'm hoping somebody out there in this audience picks that ball up and runs with it, because it is part of this conversation and it is really unquantified in this conversation. And I want to thank you all again on behalf of the steering committee. This has been an incredible effort. It's a joint effort with people that I respect and admire. And so I was really excited to participate in this, and I hope it is very useful to people. And I'm just going to say again, as everyone has said, go read the full report, read all the tabs, look through everything, and it's absolutely worth looking at. And I think it's very important that people take it back to their organizations, particularly policymakers, and figure out how we create active policy around this that engages those different populations and learns from what we do know and expands upon what we don't know. Thank you all.
Thank you, Jennifer. That's such an important call to action. Thank you, to this entire steering committee, to this study team for this wonderful partnership, for producing such a thoughtful and comprehensive look at this topic, this emerging topic. Thank you for joining us today. And again, everything will be available online. We're so grateful to be able to have this conversation with you and to continue to work in this space. I'm so grateful. This is my last opportunity to host. I will be saying farewell to CCST. And I know that CCST will continue to do great things. And I've just been so honored to work with all of you. And I look forward to watching as you continue to bring science to inform policy. Take care.